the next few days. We would like to keep in mind our colleagues and friends from Japan who've recently undergone a really horrible natural disaster. As such, please join me in just bowing your heads for a moment of silence to pay respect to our Japanese friends and colleagues who are working so hard to rebuild their livelihoods. Thank you. So what do we have planned for you today? Well, we have an excellent program. We have a mix of both plenary sessions as well as workshops, expert panels. In fact, over 35 workshops and expert panels will be offered over the next 3 days, and 8 plenary lectures covering a broad range of topics with invited speakers who are experts in their field from all around the world, who we're very privileged to have with us. So a few changes that I just want to point out in the conference program. From 1:15 to 2:45 p.m., there is one workshop which will be presented in Mandarin Chinese. It's a debriefing workshop. So if you're speaking Mandarin, you'd like to attend that, that's going to be in the Grand 3 and 4 room. There is one other workshop which was advertised as being held in Mandarin Chinese, but actually it's going to be in English, and that's assessment of team performance. Okay, so that one will be presented in English. At lunchtime today, we have a really special opportunity set up. We have 2 lunches, an opportunity for you to sit down in an intimate setting to discuss simulation with 2 of the preeminent leaders in simulation worldwide, Dan Raymer and Barry Eisenberg. You should really take advantage of this. We still have some tickets available. They're $50. And let me tell you, it's going to be a $50 well spent. We went up to visit the venue. You'll be dining in a private dining room with a big bay window overlooking the harbor and with some of the best food available in Hong Kong. So if you'd like to treat yourself to an excellent lunch, please do head up to the registration desk and register for that. The rest of us will be having the lunch provided by the conference.
And then tonight we have evening networking sessions. So this is a really great opportunity for you to come along. So there's one for Hong Kong and Taiwan, one for Korea and one for China, and then Singapore, Indonesia and Malaysia and Japan. And each meeting will take place in the language of origin. And this will just be a great opportunity to meet with your peers and colleagues in your country and discuss how you might think about moving simulation forward in the future for your country. So we really encourage you to come along to these sessions. Okay, so now I would like to welcome up to the podium Mary Beth Mancini. She is the President-elect for the Society for Simulation in Healthcare. Thank you, Mary Beth.
Good morning, everyone. Ni hao. Ohio gozaimasu. Josan. Annyeong haseyo. It is my pleasure to welcome you here on behalf of the Society for Simulation in Healthcare, which is the world's largest multidisciplinary, multi-specialty organization dedicated to improving the quality of healthcare through simulation. It's an organization of over 3,000 members, and we believe it's by coming together, working together, talking together, that we are able to achieve this goal. So we are extremely excited to participate and see so many of you here today in this regional conference to talk about simulation and how it can be expanded in this portion of the world. The energy that we feel here is incredible, and we don't want it to die here. We want it to continue and to grow. And the excellent work that's being done in the countries that are being presented here in the next 3 days need to be shared with the rest of the world. It's our belief that you will help us improve the quality of simulation and the quality of healthcare throughout the world. And we encourage you to join us in these global efforts. Participate in the Society for Simulation in Healthcare as a global opportunity. We would like you to join our 3,000 with more of our 3,000 members. We also hope that we will see you in so many of the excellent presentations we've already seen here in the poster presentations. We hope you will continue to consider bringing them to San Diego in January of 2012 to actually share them with the international meeting on this simulation in healthcare, because together we can do great things. So on behalf of the Society for Simulation in Healthcare, I welcome you here to this meeting in Hong Kong, and I say to you, Shosher, Ali Agato Godzimasu, Doje, Komsaham Netao. Please forgive me for my poor pronunciation, but my heartfelt welcome to you. Thank you for coming.
Thank you, Mary Beth. I'd now like to welcome Marcus Watson, who is the chair of the Australian Society for Simulation in Healthcare.
Good morning and welcome, everyone. It's fabulous to see you all here today. These events are very, very important. We're in a changing time and simulation is coming to the forefront. I think it's exciting to see people from so many different countries here, and I think that's largely due to the efforts of the committee involved, to SSH, in actually reaching out and bringing people together. In Australia, we're very privileged to have a government that has seen that simulation could do a lot for healthcare. It could improve our education, it can improve our systems. But on a scale of things, Australia is quite a small population, and there is no way that we are going to be able to lead this alone. In fact, if we want the type of growth, such as exponential growth, that is going to make the critical changes to healthcare, the only way we're going to achieve this is through collaboration. So this meeting represents an example of collaboration between SSH and ASH and the many, many members of the committee who represent a broad range of the Asia-Pacific area. It is crucial that we carry this on. So I ask you today that when you participate, you're actually planning on thinking about what we're going to do next year and the year after to extend these collaborations. How we're going to work together, how we're going to learn from each other, how we're actually going to be able to plan to implement and extend the impact of simulation, both in our education and in the way we use it to actually deliver our healthcare. So welcome. Thank you for attending. Thank you for your time that you've put into posters, to presentations, to the workshops. And thank you for the energy you're going to deliver to your peers to bridge gaps that may exist at the moment, to extend welcomes, and to learn from each other. I hope this meeting is as exciting as it was yesterday for the workshops. I hope that extends throughout the entire meeting and leads to a much, much larger level of collaboration, a larger meeting in the future. So please take on the challenge of thinking about how we can extend collaboration, and please join me in thanking the committee for all the work they've put into delivering this fantastic conference. Thank you.
Thank you, Marcus. I'd now like to welcome Professor Huang from Shanghai in China. Thank you.
Good morning, ladies and gentlemen, dear professor and specialist. We are very happy to be gathered here to discuss some simulation in healthcare and share the experience about medical education. First, I really appreciate Dr. Adam Chen, C.C. Lu, and T.W. Li, and Katie Walker for your kind invitation. And then on behalf of our National Training Center of Medical Practice and School of Medicine, Shanghai Jiao Tong University, and also in my own name, I would like to extend my warmest congratulations to this meeting, successful and meaningful. As we know, simulation in healthcare is a young discipline in medical education and has a history of only about 30 years, but it's developed very quickly because it's indeed great importance of improving medical practice, clinical skill, and patient care, and also patient safety. Therefore, simulation in healthcare should be considered to be a necessary part of national medical education. In fact, we have already used human patient simulator as important tools for the clinical courses and objective structure clinical examination to evaluate comprehensive capacity of medical students in our medical school, Shanghai Jiao Tong University. And also, I would like to facilitate the possibility that human patient simulator as essential tools for the national examination of doctor license. However, the question is, what's the standard of simulation in health care and how evaluate it quantitatively? So I suggest this meeting should address these questions and set down a global essential standard of simulation healthcare in healthcare. I think it's a very important issue in medical education, and especially for nowadays. I believe this meeting will get more effective in simulation, in medical simulation and education. And I also believe if we are headed in the right direction, each step, no matter how small, is getting us closer to our goals. Thank you very much for your kind attention. And we warmly welcome you to visit Shanghai, a very beautiful city, and visit our medical school. It's one of the largest and oldest medical school in Shanghai. I'm sorry for another second because there is more than 100 Chinese specialists here. So I have welcome a speech in Chinese again. 非常感谢各位嘉宾，因为今天我知道这里有近100个来自中国以及大陆的我们一些专家。那么我想呢，我也同样用中文说一下我的一个欢迎词。我首先呢，代表我们国家的临床示范中心及上海交通大学医学院，对各位中外嘉宾的到来表示热烈的欢迎，同时呢，也祝本次大会能够成功及顺利召开。我们都知道，模拟医学教育是一个新兴的学科，在医学教育方面，同时呢，它的历史是不到30年，但是它发展非常快，因为它在医患沟通、病人安全以及临床技能的提升方面呢，有着极为重要的作用。那么在这里呢，我们也特别希望模拟医学教学能成为整个医学教学中最重要、最关键的步骤。当然，在上海交通大学医学院，我们已经尝试着用模拟医学教学作为临床医学课程，同时也作为 OSCE 考试的一个非常重要的部分。同时，我也希望能够推动国家医师考试能够用我们模拟医学教学和模拟医学教具。那么，我相信呢，在整个会议中呢，应该更多的关注一下这个模拟医学教育的一些标准和定量分析，因为它在整个医学教育和教育评价中可能非常的关键。我相信呢，本次会议应该会关注这个问题，同时呢，也应该能够建立一个全球的基本的模拟医学教育的一个标准体系，这样对于我们来评价学生会有一个比较重要的作用。同时，我也相信，我们只要有一个正确的方向，每迈出一小步，都是对于我们的目标更接近一步。非常感谢大 大家的光临，也非常欢迎大家有时间到美丽的上海，到上海交通大学医学院来访问指导。谢谢 ，Thank you very much。